ESMO 2018 in Munich, what to bring home for gastric cancer. We have seen interesting abstracts on the third-line treatment of advanced gastric cancer, but we have also seen interesting analysis on gender differences. Is it the same for men and for women? We have seen a complete presentation of the TAC study, and this is a third-line metastatic gastric cancer study that involved patients with a good performance status to receive either an active compound, which is called FTD-TPI, or also known as trifluridine tipiracil or TAS-102. This is an oral compound which has similarities with fluoropyrimidines, and this compound was compared to placebo and best supportive care. And the objective of this trial that randomized more than 500 patients was to show that FTD-TPI improves overall survival. And the results are quite convincing, because the active compound FTD-TPI shows a significant improvement in overall survival, and also all secondary endpoints were improved in favor of the active compound in all subgroups that we have seen. So this is really good news in my view for physicians and especially for patients, because it may give us a new opportunity to treat our patients in third line with FTD-TPI. There is the ongoing discussion about the role of immunotherapy. And we have seen results from third line comparing nivolumab, a PD-1 inhibitor, versus placebo just 1 year ago, with an important publication in Lancet that showed that nivolumab is superior to placebo and best supportive care in the third line setting. This is a study that has been done exclusively in East Asian patients, which means in Korean, Japanese and Taiwanese patients, but probably we have some hints that this could also be true for a European or for a non-Asian population. It's really reaffirming to know that also with a longer follow-up, it is confirmed that nivolumab is effective. We have seen 1 year overall survival rates and also overall survival rates at 2 years, and at both observation points we have a clear and clinically relevant difference as compared to placebo. So nivolumab, PD-1 inhibitor, and maybe also others which are developed in this field, may also become an option to treat our patients in third-line metastatic gastric cancer. We saw an interesting presentation on gender differences comparing men and women when it comes to first-line combination chemotherapy in advanced gastric cancer. The investigators looked at efficacy differences, but also at toxicity differences. And interestingly, they observed that when it comes to efficacy, there is no true difference between men and women, but importantly, when they analyzed the magnitude of toxicity, there was a disadvantage for the women. They experienced more non-hematological toxicity, especially GI toxicity, gastrointestinal side effects, but they also experience more hematological toxicity. So at the end of the day, we really need to take attention to that point, because it might well be that women who we treat experience more toxicity, so they will need an optimal support. Our objective is certainly not that we decrease too much the doses or delay too much the treatment regimens. The objective really should be that we give optimal support, that they tolerate these treatments better. And also for the future, we need to keep in mind that in future studies, we need to keep an eye on that and need to analyze for gender differences. My message from ESMO 2018 is that we have a changing landscape for the treatment of advanced gastric cancer, and we are starting to have interesting, efficacious and hopefully also approved treatment options for third-line advanced gastric cancer in the future based on the data that have been presented at ESMO. But we also should take attention to the gender differences we had seen with chemotherapy. Toxicity differences between men and women may become important in this field.